Hello, my name's Carl Bauer. I'm the rehab director here at MMC, and I've worked here for 39 years now, and I can honestly say that I'm honored to work beside and with the team of rehab professionals that you're going to meet today. You're going to be getting a tour of the department with Betty and Courtney, and they're going to show you a few of the pieces of equipment that you might use in your rehab journey.
Hi, I'm Betty Madison, physical therapist here at MMC.
And I'm Courtney Rausch, physical therapist.
We've been working together for 3 years at MMC, and we're part of a 12-person rehabilitation team consisting of speech therapy, physical and occupational therapy. Together, all of us have over 225 years of experience.
I think that's one of the things I like most working about MMC, because we have so many therapists, we all have our unique skills. For instance, Betty and I are lymphedema certified, so we help people with chronic swelling.
We each have a specialty such as women's health, vertigo, wound care, manual therapy, pediatric, lymphedema, and TMJ. We can provide each patient with high-quality specialized care and also take advantage of the large pool of knowledge from the rest of the team. We start every appointment by understanding what your goal is and then work to make a plan for you to achieve that goal. The entrance is in the back parking lot of the hospital, opposite from the emergency department. Once you park, come on into the waiting room and check in. From there, one of our therapists will take care of you. While our strength is in movement analysis and use of our hands and exercises for meeting your goal, we thought it would be fun to show you some of the exercise equipment we have in the back that is special to our department. And Courtney here has been gracious enough to act as our patient. This is our Ultra G, or anti-gravity treadmill. It eliminates a significant amount of your weight to decrease the strain that it places on your joints when you're walking or running. So it's really helpful to normalize a person's gait pattern.
I utilize the Ultra G with a huge variety of patients. We could reduce somebody's weight from 1 to 80%, and it really helps you basically remember how to walk again, so there's a lot of carryover when you're just walking around.
So let's have Courtney put our shorts on and show you how it works. So now we have Courtney in the cockpit, and we're going to inflate the machine, and she's very safe. So we're going to start the machine, and it's going to calibrate her weight so that when we tell it how much weight we want to take off, we can do that. So it takes a minute to do that. And if you look at her feet, it's going to lift her right off. And it's going to do that 2 times. And it does not tell us how much she weighs. And then once we have it calibrated, it functions just like a normal treadmill. And then it's going to deflate, and we'll start from scratch. Okay. So now let's say that she had an ankle fracture. So we're going to start off kind of conservatively and take off about 50% of her weight. We want a weight which has no pain when she's walking. So we're going to take off the weight, and it's going to blow up till it matches that. And then I'm going to have Courtney turn the treadmill on nice and slowly. And again, we can watch her gait pattern through the bubble or on the screen up above. And we want to watch as normal of a gait pattern as we can. And if we turn it up too high as far as the speed, we can turn it down if she has pain. Or we can say, oh, Courtney has a little pain in her ankle now. Let's take a little bit more weight off until she doesn't have any pain, and then she can walk. Whereas normally you may not be able to walk more than 10 feet. And then there's 3 cameras. There's a camera from the front, a camera from the back, and a camera from the side. So she can have biofeedback seeing what her feet are doing at the same time. And she can flip through those screens, and we can give her cues from what we see on there. As far as, oh, you make one stride longer than the other, make some corrections. So we do this however long that we choose to do during her plan. And she feels good about actually being able to walk whereas she couldn't before. Of course, we have higher level athletes on here too, as far as running for gait analysis and such. It's very much fun, and patients usually really like it. See, she's smiling. Okay, so then we're going to be done. So I have her bring the treadmill all the way down, and the treadmill can also incline. She can walk backward or whatever we feel like is part of her plan. So it's down to, then we're going to slowly increase to all her weight again, so we don't all of a sudden go to full weight and then she will have pain. So we're going to increase the weight. It's going to slowly deflate. And then we stop. And that's the end of that anti-gravity treadmill exercise. Okay. This is our Biodex balance system, and it works on one thing, your balance.
We utilize it with patients that are struggling with their balance, and it helps us train them on uneven surfaces in a safe environment.
It can also be used to show your progress if one desires to do that. We'll have Courtney hop on up here and we'll show you how it works. So we'll turn it on. And we have the bars here, and the bottom is what becomes unstable. So to start out with, we want her to be holding on. And you can train and you can test, but we'll just train. And there's multiple different challenges we can have. For instance, we can do just weight shift. We can put parameters in there if we want to test her, but I don't want to do that. You can have different levels of intensity. We'll make it kind of easy for Courtney. Okay, and then we can make it difficult and how unstable this bottom plate is. We're going to bring it down so that you can see it moving. And Courtney's pretty good, so we're going to have it a little bit unstable. So then we're going to start it, and there's going to be a dot right in the center of this, and she can see that she's balanced with the dot right in the middle of the cross there. And then she can see that her weight is equally distributed, and then she can work on control of going from one side to the other side. So she can work on her control and her finesse. And some people really don't want to go to one side, so they really can work. Of course, I would have a gait belt on her. And there's that graph so she can really see what she's doing, which offers that biofeedback. And if she wants to restart and say, oh, it's getting too messy, we can erase it, and she can start from scratch. So that's just one of, I believe, 8 different programs that are on here to make balance kind of fun. And it can be as challenging as we possibly can. Courtney, let's show them how challenging it can be. Hold on to the bar, and I'm going to make the base really unstable, and then it's really hard to stay there. Okay. So it doesn't take long for people to get tired. So then she can hold on to the bars, and I'm going to stop it. And again, this becomes very stable then. And then she can hop off and be done with that. And be thankful she's on solid ground once again. This is another piece of equipment we have here at MMC. It's called a Pilates Reformer, and it works on balance, strength, flexibility, stability. It's very versatile. All ages can work on this machine. It can challenge you as much as we need to be challenged using different positions. For today, for demonstration purposes, we're going to have Courtney lie on her back, which is the most safe position. And we're going to work on her arm strength and her core strength. We'll go ahead and bring your hand right there, some straps, which can also be used for your feet. And to challenge her, we're just going to have her legs just like this for demonstration. And she really holds her trunk nice and still. And then we work on breathing. So you're going to breathe in and breathe out and bring your hands down by your side. And you can see how the springs are being used as a resistance. And you're going to breathe in, coming back, and everything's very controlled. And if she couldn't hold her legs here, I could hold her legs and she could still work her arms and her trunk. And if she wanted to work her trunk more, she could lift her trunk up. Go ahead and lift up at the same time and then back down. Okay, and then we're gonna bring your legs back down. And I will take these down. And that's one position we could do things in. So that's the end of this exercise. There are many other positions that we can place you in when you're doing your exercises to meet your goal. So this was a look at 3 of the most unique pieces of equipment that we have here at MMC.
That being said, we help patients customize their rehab plans every day, and a lot of times they include simple exercises and stretches they can do at home to help you achieve your goal.
So if you have something that you want to work on that you're not happy with at home, whether it be flexibility, not being able to walk very well, or have pain, what you want to do is talk to your primary care provider and receive a referral to come to receive your therapy here at MMC.
We'd love to hear from you and help you achieve your therapy goal. Thanks for watching.